Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the book Focused Neurology. My email is sreeklpm@gmail.com. Today we are going to talk about a very important and practical topic, the caloric test. The caloric test, cranial nerves, part 58, vestibular cochlear nerve, 8th nerve, part 8. The caloric test. Caloric responses are frequently used to check for brainstem integrity in comatose patients. Ice water instilled into one ear canal will abruptly decrease the tonic activity from the labyrinth on the irrigated side. Cold calorics in a comatose patient with an intact brainstem causes tonic deviation of the eyes towards the side of irrigation as a normally active labyrinth pushes the eyes towards the hypoactive irrigated labyrinth. The normal labyrinth, when it is stimulated, for example right side, it pushes the eyes towards the opposite side. So the normal labyrinth can be stimulated in two ways. One, turning the head towards the side of the labyrinth or pouring warm water. So when we put warm water or when we stimulate the labyrinth by turning to one side, the eyes are deviated to the opposite side. So the normally functioning intact labyrinth, when it is stimulated, it pushes the eyes towards the opposite side. That is a normal response. It acts to the PPRF. But on the other end of the spectrum, if the labyrinths are defective or non-functioning or made non-functional by putting cold water, the other opposite intact labyrinth will push the eyes towards the labyrinth which is non-functioning or made non-functional by putting cold water. So the eyes will deviate towards the side of hypo-functioning labyrinth or the labyrinth on which cold water has been put. This is the normal physiology. So when we put warm water or turn the head to one side, we stimulate the labyrinth, so it pushes the eyes towards the opposite side. But body always tries to maintain the body in equilibrium. So the cortex on the side where the eyes are stimulated, the frontal eye fields area number 8, will push the eyes back towards normal by giving a saccadic jerk. So you will have a nystagmus. So when we put warm water or stimulate the labyrinth, the eyes will deviate to the opposite side, but the labyrinth on the opposite, but the cortex on the opposite side, that is frontal eye field area number 8, will push the eyes back towards the opposite side. So there will be nystagmus. So when we put warm water, when we put cold water, the nystagmus is on the opposite side. When we put warm water, the nystagmus is on the same side. This is the acronym COWS, C-O-W-S. So when we put cold water, nystagmus is on the opposite side. When we put warm water, the nystagmus is on the same side. The explanation is that when you put warm water, you are stimulating the labyrinth, eyes will go to the opposite side, but the cortex will try to push the eyes towards this side. So when you put warm water, example on the right side, eyes will go to the left side, but the frontal eye fields area number 8 will push the eyes towards the right side. So there will be nystagmus to the right side. That means the same side of stimulation. That is warm water. When you put at the other end of the spectrum cold water, you are inhibiting the labyrinth or it is made non-functional. So the opposite side labyrinth, for example the left labyrinth, will push the eyes towards the right labyrinth which is non-functional. So this time the cortex frontal eye fields area number 8 will try to push the eyes towards the opposite side. So you have nystagmus. So when you put cold water, the nystagmus is on the opposite side. When you put warm water, the nystagmus is to the same side. Kindly note that the nystagmus we are talking about is the compensatory phase done by the frontal eye fields area number 8 and not the tonic deviation by stimulating or inhibit the labyrinth. We are talking about the nystagmus. So very important point. So in an awake patient, cold calorics causes nystagmus with a fast component away from the irrigated side because the cerebral cortex produces a compensatory saccade that jerks in the direction opposite the tonic deviation. The familiar mnemonic COWS, cold opposite, warm same, refers to the fast phase of the nystagmus and not to the tonic gaze deviation. Nystagmus is seen only when the cortex is functioning. Warm water irrigation has opposite effects. So here you can see the caloric testing response given in a nice tabular column. On one side we have the stimulation, then the awake patient, then the comatose patient with intact brainstem. So what happens when you put cold water? You're inhibiting the labyrinth or making it non-functional. So the opposite side labyrinth will push the eyes towards the side of the inhibited labyrinth. So there is a tonic deviation of the eyes towards the side of irrigation when you put cold water. So as a compensatory phase, now the cortex front light fields area number 8 will push the eyes towards the opposite side. There is a nystagmus with fast component away from the irrigated side. Right. Now what happens when we put warm water? When you put warm water, you are actually stimulating the labyrinth. So when you put warm water, you are stimulating the labyrinth. So the eyes, for example, if you put warm water on the right labyrinth, you are stimulating the right labyrinth. So the eyes will tonically deviate to the left side through PPR, paramedian pontine reticular formation. So there is a tonic deviation of the eyes away from the side of irrigation. So now what happens in the compensatory phase? The cortex, that is the front eye fields area number 8, will push it back through a saccadic jerk. So there is a nystagmus with fast component towards the irrigated side. That is an awake patient. So these are the fundamental concepts we need to understand. In comatose patients, large volumes of ice water, 30 to 50 ml, are commonly used because it is imperative to elicit the response if it is present. The latency in comatose patients lying supine, this is done with the head flexed 30 degrees to bring the horizontal canal vertical. Whereas for awake patients, the same position may be used or the head may be extended with the seated patient looking at the ceiling. So these are the fundamental concepts of caloric testing. I hope you have enjoyed listening to these wonderful concepts. The other important concepts of neurology I put in a question answer format in the book Focused Neurology, written by me, Dr. Sreenivas. It is available online from all leading booksellers including Amazon. So if interested, this book could be purchased online. If you have liked this video, please like and share the link, but do subscribe to my YouTube channel, Dr. Sreenivas Medical Concepts, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.